Apparently, this order had been placed on my wife. It wasn't till the night she died that I was spoken to about the order ever being placed. Even after that, I wasn't sure what the order was or what it really meant. Generally, the doctor was very vague.
My son had a cardiac arrest in the hospital and they were able to resuscitate him. Immediately after, this order was placed on him as he wasn't suitable for the specialist care unit. I raised my concerns about this decision and I wasn't happy about the fact that he wouldn't be resuscitated if he arrested again. A member of the clinical team discussed this with me in the main corridor of the ward, and it left me feeling as though staff had given up on him.
Hello, Mr. Jones.
Hi.
My name's Ali. I'm one of the doctors that met you before, and we went through the history and examination that you had. Is it okay if I take a seat and have a word? Thank you very much. So, following the history and examination that we had earlier, I just wanted to come and explain a little bit about what we found. Based on the investigation so far, we can see quite clearly that you have a chest infection. However, the concern for us is right now that the infection has spread into your blood. Now, that is quite a serious sort of situation, and when that happens, it's known as sepsis. So, based on that, currently, our intentions, or my intentions currently, is to start you on antibiotics to help you try and clear that infection.
Yeah.
What do you make of that? How does that sound to you?
Go for it, yeah.
I know you have, your background issue that I've read about in the notes. What I'm going to do though is do some further reading about you and draw up a sort of treatment plan about which antibiotics to start,
Okay.
and do some further blood tests and investigations.
Okay.
How does that sound, Mr. Jones?
That sounds good.
Okay. If I come across any more information or any more updates, I will come and let you know.
Okay.
Okay. Thank you very much.
Thank you.
Hello, hi. Can I speak to my registrar, please? Thanks very much.
Hi Ali, you okay?
Hi, yeah, thank you very much for coming, Doctor.
Okay.
It was a patient that I wanted to discuss with you, Mr. Richard Jones. He's a 30-year-old gentleman. I did his history and examination earlier. The diagnosis I've come to for him is sepsis secondary to a chest infection.
Okay.
The issue I'm having with him is he is suitable for antibiotics. However, when I was looking through his notes, it suddenly occurred to me that there may be more to it because his sort of background includes advanced malignancy.
Oh, right. Yeah.
So sort of it did occur to me during that does this change things now?
What were you thinking?
I haven't actually broached the topic of his malignancy or any options towards resuscitation with him. So I'm kind of at the crossroads now where antibiotics, yeah, of course, antibiotics can go up at any minute, but
And do you think he should be for resuscitation?
I think it's definitely worth having a discussion with him on what his views are on that.
Okay.
But considering his history, it's certainly an option.
Okay, I'll go and have a talk with him about it.
I really appreciate that.
Okay,
Thank you
that's
very
fine,
much.
No problem. Hi, Mr. Jones. My name's Leanne. I'm one of the other doctors. I just wanted to have a chat. Is that all right?
Yeah, sure.
I've had a chat with Ali, who's the doctor that you met earlier on, and he's explained, your problems and what you've come in with and things. And I just wanted to have a bit more of a chat about it, if that's okay.
Yeah.
What do you understand by what's sort of gone on and what you've been told so far?
I understand that I've got sepsis, which the antibiotics will hopefully clear up.
Yeah. Anything else that you've sort of gathered from what we've talked about so far?
I think that's about it.
That's about it, yeah. Yeah, so you're right. We feel that you've got a chest infection, so we've started you on some antibiotics for that, and hopefully, as you say, that'll kick in and you'll improve and you'll start to feel better very soon.
Yeah.
Now, what I wanted to talk to you about is, and it's not obviously a very nice thing to have to discuss, but what would happen if, say, you didn't improve with the antibiotics, and say we got to a stage where you were very unwell and we were very worried about how you were going to be and how you were going to do. Have you thought about what would happen in a situation where you became more unwell?
I have, yeah.
And what sort of things have you thought about in that situation?
Well, if it became unbearable, I wouldn't like to drag it out.
So you wouldn't want to sort of suffer
No.
unduly? Okay. I mean, obviously I've had a look back at your history and the other problems that you've got going on, and I've had a chat with Ali, and obviously we want to treat this infection and get you better and get you home. Now, what I would be conscious of is putting you through suffering that we didn't need to do. And I feel in the situation that you became gravely unwell and we were worried about whether you would survive, and worried about situations where your heart was possibly going to stop or your breathing was going to stop. I feel in that situation the best thing to do at that point would be to keep you as comfortable as possible and not go down the route of trying to resuscitate your heart and restart your heart with compressions and a breathing machine and things like that. And the reasons that I think that is, obviously there's a very low chance of it being successful, and also if it was to be successful, it might leave you in a position where you're in a lot of pain or weren't able to have the quality of life that you may have had once before. What do you think about that, just as a starting off point?
I think that's probably the way to go, yeah.
Okay, and obviously that doesn't take away from the fact that we're going to be treating this infection as to the best of our abilities. We're really going to give it everything that we have, and it's only in the situation that we get to, if we get to it, where you're gravely unwell and things aren't responding, that we would look to that. Okay, so I think we've still got everything at our disposal at the moment to see how things go with the infection. Is there anything you want to ask about that?
Not just now, I don't think.
Okay. Now, do you have family?
Yeah.
Yeah. And have you thought about discussing this with your family?
Yeah.
Would you like us to help, or do you think that's a discussion you'd want on your own?
If I could do it on my own.
On your own. Well, if you or they do want a discussion at a later point, we'll be around to have that discussion.